Okay, picture this. Your furry best friend, maybe snoozing at your feet, suddenly lets out a little sneeze.
Hmm.
Then another one. You lean down, check on them, and maybe you notice just a tiny speck of blood mixed in.
Yeah, that'd be
A
concerning.
little concerning, right? Well, that kind of head scratcher leads us right into today's topic. Oronasal fistulas in dogs. It's a bit of a mouthful, I know,
It is.
but we're going to break it down.
Yeah, absolutely. Essentially what we're talking about is an unexpected connection, an opening where there really shouldn't be one,
Okay.
between your dog's mouth, the oral cavity, and their nasal passages.
Yeah.
Imagine like a little tunnel developing between those two areas.
Areas that are meant to be separate.
Completely separate, yeah.
So how does this connection, this tunnel, even get created? Our sources say it usually stems from problems with the tissues right around the upper teeth,
The maxillary teeth.
or even the hard palate, the roof of the mouth.
Exactly. And it's interesting, there are definite hot spots for these openings.
Oh, yeah. Where?
The most common area is around those big upper fangs, the maxillary canine teeth.
Okay, the big ones up front.
Right. And then the area near the palatal root, that's the root towards the roof of the mouth of the maxillary fourth premolar. That's another frequent site, a bit further back.
Gotcha. Now, people listening might be wondering, are some dogs more likely to get this?
And the answer is yes, definitely. Our deep dive points towards what are called dolichocephalic breeds,
That's the fancy term for?
long-headed dogs, dogs with longer snouts.
Ah, okay.
And dachshunds specifically seem to be more prone.
Huh. Dawson's. Interesting.
And it's worth noting, this is actually pretty rare in cats.
Good to know. So our mission today, then, is to really understand what kicks these oronasal fistulas off, how vets figure out that's what's going on.
What the options are.
Exactly. What can be done about it? So by the end of this, you should have a really clear picture of this condition.
To dive in.
All right, so maybe you suspect your dog has one of these. What are the telltale signs? What should you be looking for?
Well, the sources really highlight chronic rhinitis as a key indicator.
Rhinitis, like a runny nose.
Kind of like a persistent runny or stuffy nose in your dog, yeah.
Right.
Often comes with sneezing.
Okay.
And that discharge, it might have a little blood mixed in or it might not. It varies.
And the sneezing?
Exactly. Sneezing is a really common sign owners might notice. And what's particularly interesting, sometimes this sneezing gets worse or happens right after you gently touch those upper canine teeth.
Oh, really? So just palpating that area.
Yeah, gently feeling around the gum line there might trigger a sneeze. It can be a valuable clue.
Okay, so we're watching for sneezing, maybe nasal discharge, maybe with blood, especially related to touching those upper teeth. But what's actually causing these fistulas? Let's dig into the causes, the risk factors.
Right. And the number one culprit, the most common cause by far, is something lots of dog owners deal with. Advanced periodontal disease.
Gum disease.
Serious gum disease, yeah. Specifically, the really severe stage, often labeled PD4.
PD4, okay.
Especially when it affects those upper canine teeth. What happens is the infection gets so bad, it actually destroys the bone.
The bone between the tooth root and the nose?
Exactly. That thin shelf of bone that normally separates the mouth from the nasal cavity, it erodes away. The barrier breaks down.
Wow, okay, that makes sense. But it's not only about bad teeth, is it? The sources mentioned other ways these can happen.
Absolutely not just teeth. Trauma is another big one. Like from an accident, a fall,
Sure.
or even things like splinters or other foreign objects penetrating through. Bite wounds can do it.
Ouch.
Yeah. And sometimes, unfortunately, complications after a tooth extraction can lead to a fistula.
Okay.
Less common causes include things like electrical shock, and sadly, sometimes oral cancer can create these openings too.
So quite a range of possibilities then. Now, the sources also mentioned something about the fistula itself, like how wide or deep it is, giving clues.
Yeah, that's quite interesting. The width of the opening often seems to relate to the size of the tooth involved.
Ah, so bigger tooth, potentially wider fistula?
Generally, yes. And the depth often tells a story about how long the infection, usually the periodontal infection, has been going on.
So deeper means it's been there longer.
Typically, yeah. Deeper fistulas tend to be linked to more chronic, long-standing infections.
And what about how a dog's teeth line up? Does malocclusion play a role?
It definitely can.
Yeah.
Dogs with lower canine teeth that point inwards, sometimes called base narrow canines.
Right, I heard of that.
Those teeth can actually rub against the hard palate, the roof of the mouth,
Over time,
causing damage.
causing damage, irritation, and eventually, potentially, an opening.
Okay.
And similarly, dogs with a really significant overbite, where the lower jaw is much shorter than the upper what vets call mandibular disocclusion.
Like a severe overjet.
Exactly. Their lower canine teeth might actually penetrate the hard palate when they close their mouth.
Yikes.
Yeah. And again, we have to mention dachshunds. They just seem predisposed, likely because of their head shape and maybe tooth structure. Okay, so we know the signs, we know the potential causes. How does a vet actually confirm, yes, this is an oronasal fistula? What's the diagnostic process?
That's a crucial step, obviously. And interestingly, standard skull x-rays.
Like if they bump their head?
Yeah, those big picture x-rays. They're usually not that helpful for spotting these.
Why not?
Well, the fistulas are often quite small, and they're located right there on the roof of the mouth, so they often just don't show up clearly on a standard skull view.
Yeah.
The angle isn't right, the detail isn't enough.
Okay, so regular x-rays are probably out. What do vets use then?
The gold standard really is intraoral radiographs, x-rays taken inside the mouth.
Like dental x-rays for people.
Exactly like that. They give a super detailed view of individual teeth and the bone right around them. They're essential for assessing the health of the suspected tooth and the surrounding bone structure.
And can they show other things too?
They can. Occasionally, they might reveal a hidden foreign object or sometimes signs of bone destruction, lysis, which could point towards cancer.
Okay, so focused x-rays inside the mouth. Is there a more kind of direct, hands-on way to tell?
Absolutely. The main diagnostic technique is something called periodontal probing.
Probing.
Yeah, the vet uses a very thin, specialized instrument, a periodontal probe, to gently explore the gum line, the sulcus, around each tooth.
Okay.
If there's an oronasal fistula, particularly around that maxillary canine, the probe will often just slide right through the defect and into the nasal cavity.
Whoa. Directly in.
Directly into the nose.
Mm-hmm.
Or sometimes even just probing that area gently will cause a little bleeding from the nostril on that side. Epistaxis.
Wow. Okay. That sounds like a pretty definitive sign then.
It's a very strong indicator, yeah.
Yeah.
That direct communication is key.
Now, could anything else mimic these signs? Are there other conditions to rule out?
Yeah, differential diagnoses are important. You'd want to consider general periodontal disease, even if there's no fistula yet, as that can cause inflammation and maybe some discharge.
All right.
Oral cancer, like we mentioned. Trauma that didn't create a fistula could still cause swelling or bleeding.
Yeah.
And even things like a foreign body stuck up the nose, grass seed or something.
Sure, could cause sneezing and discharge.
Exactly. So ruling those out helps confirm the fistula is the primary issue needing specific treatment.
And what about regular blood tests? Like a CBC or chemistry panel? Do those help diagnose the fistula itself?
According to our sources, no, not directly. Standard blood work isn't going to specifically identify the fistula.
Okay.
Those tests are more for checking the dog's overall health, kidney function, liver function, checking for infections systemically, which is really important before anesthesia and surgery, but they won't pinpoint the fistula itself.
Got it. All right, so diagnosis is made, often with probing and intraoral x-rays. Now for the big question, what can be done? How do you fix it? Let's talk treatment.
Okay, so the main goals are really twofold. First, you have to address the underlying cause.
Which is often that bad tooth.
Often the bad tooth, yes. So frequently, that means extracting the affected tooth if it's due to severe dental disease.
Okay, get the source out.
Exactly. And second, you need to surgically close that abnormal opening, that defect between the mouth and the nose.
And what's the basic idea behind closing it?
The fundamental principle is to create a new, intact tissue barrier. You need to reestablish that separation by getting an epithelial layer, like the surface skin or lining, to cover the hole on both the oral side and the nasal side.
Sealing it off from both directions.
Precisely. You need to rebuild that wall.
And I imagine there are different ways surgeons do this.
Yes, several techniques exist, and the choice depends heavily on the size of the fistula, where it is, and maybe what tissue is available nearby.
Okay, what's a common one?
A very common method is the full-thickness flap, often called a mucoperiosteal pedicle flap.
Okay.
So after the tooth is removed, the surgeon makes careful incisions to lift a flap of the gum tissue, including the layer covering the bone, from an area right next to the fistula.
Like borrowing tissue from next door.
Kind of, yeah. This flap is kept attached at its base, so it still has a blood supply, and it's gently stretched or moved over the opening and then stitched securely in place.
Are there specific requirements for that to work?
Yes, definitely. You need enough healthy gum tissue nearby. Specifically, at least 2 millimeters of attached gingiva above the defect is ideal. And the sutures, the stitches, need to be placed on the edges, anchoring the flap to healthy tissue, not directly over the hole itself.
Ah, so you're not stitching into the weak spot.
Exactly. And crucially, there must be absolutely no tension on that flap. It needs to lie passively over the defect. Tension is a major reason for failure.
Makes sense. So that's the full thickness flap. What if it's a bigger hole or maybe a repair that failed before?
Right, for larger fistulas or situations where a previous repair didn't hold, or maybe if there just isn't enough good quality attached gum tissue right there.
Then you need something more.
Then a more complex technique might be required, like the double reposition flap.
Couple. So two flaps.
Exactly, the two-layer closure. First, a flap is typically raised from the hard palate, near the fistula. This palate flap is carefully prepared and then inverted, flipped over so its raw connective tissue side faces towards the nasal passage, forming the nasal side closure.
Okay, that's layer one.
That's layer one. Then a second flap, usually a larger sliding flap, is raised from the cheek side, the buccal mucosa, and the tissue from the underside of the lip. The second flap is then mobilized and moved over to cover the first palate flap and the area where the palate flap was taken from.
Wow, like building a multi-layer patch.
Pretty much. It provides really robust, double-sealed closure. It's definitely more intricate surgery, though.
I can imagine. Now, the sources also mentioned something called guided tissue regeneration, GTR. Is that for fixing existing fistulas?
Ah, good question. In this context, GTR is described more as a preventative measure, actually.
Preventing a fistula. How?
It's used when a vet finds a really deep periodontal pocket around that maxillary canine tooth, but it hasn't broken through into the nose yet. There's no fistula yet, but there's a high risk.
Okay, so it's deep, but not all the way through.
Exactly. So the procedure involves raising a gum flap, thoroughly cleaning out all the infected tissue and calculus from that deep pocket right down to the root.
Debriding it.
Right. And then bone graft materials are placed into the clean defect.
To encourage bone to grow back.
Yes, the goal is to stimulate regeneration of the lost bone and the periodontal ligament, while also using a membrane sometimes to prevent the gum tissue itself from just quickly growing down into the pocket space. You want bone and ligament, not just gum tissue filling the void.
I see. So you're trying to rebuild the support before it fails completely and becomes a fistula.
Precisely. It's proactive treatment for those very deep pockets.
What kind of bone graft materials did the sources mention?
They listed quite a few possibilities, things like perioglass, consul-ren, different types of synthetic and natural hydroxyapatite.
Okay.
Bone taken from the dog itself, which is autogenous bone, or bone from another animal source, heterologous bone. Also polylactic acid, and something called osteoallograft, which is freeze-dried canine cadaver bone.
A lot of options there.
Yeah. But one important point the source made was that dental implant materials should not be used if a fistula is already present. GTR is for preventing or for pockets, not for existing fistula repair with implants.
That's a critical distinction.
Right.
Okay, what about fistulas that aren't near the canine tooth? Say one right in the middle of the roof of the mouth.
Right, those central hard palate fistulas. For those, a technique called a transposition flap might be used.
Transposition.
Yeah, it involves designing and moving a flap of gum tissue from an area right next to the defect, laterally, to cover and close that central opening. You're basically sliding or rotating a piece of adjacent tissue over to patch the hole.
Got it. So it sounds like surgeons have quite a toolkit depending on the specific fistula. Now, did the sources mention any medications, like drugs to treat the fistula itself?
Interestingly, no.
Mm.
According to this deep dive, there aren't specific drug therapies mentioned for directly treating the oronasal fistula. The focus is really squarely on surgical correction.
Makes sense. It's a structural problem.
It's a hole that needs closing.
And what about any warnings, contraindications, or drug interactions related to these treatments?
Again, the source material we looked at didn't really go into detail there. It didn't specify particular contraindications or drug interactions associated with oronasal fistula repair itself, beyond the usual considerations for any anesthesia and surgery in dogs.
Okay, so surgery is the main event. What happens after? What should owners expect post-op recovery?
Well, after the surgery, it's the standard post-operative monitoring you'd expect.
Checking for pain, infection.
Exactly. Making sure the dog is comfortable, eating okay, that the surgical site looks good, no immediate signs of the repair breaking down. Pain management is key, of course. Soft food is usually recommended for a period.
And long-term, what's the outlook, the prognosis?
It can be a bit variable, honestly. The source points out that even with really good surgical technique and seemingly enough tissue, sometimes these repairs can fail. The opening can persist or reopen.
Why would that happen if the surgery went well?
It's thought that the constant movement in that area, just from normal breathing, sniffing, maybe licking, can put stress on the healing tissue and sometimes prevent a complete, lasting seal.
Ah, That makes sense. It's a dynamic area.
Very dynamic. And as you'd expect, the prognosis is generally less favorable if there wasn't much healthy tissue to work with in the first place, or if the surgical technique wasn't quite optimal.
Meaning more surgery might be needed?
Yes, those cases might require additional surgeries, potentially using those more advanced flap techniques like the double flap we discussed, to try and get a successful closure.
Okay. So let's try and wrap this up. To bring it all together, what are the main takeaways people should remember about oronasal fistulas in dogs?
I think the key points are, these are abnormal connections between the mouth and nose. They often happen because of problems in the mouth, especially advanced dental disease around those upper canine teeth.
And watch out if you have a dachshund or other long-nosed breed.
Right, certain breeds are definitely more prone. And recognizing those early signs that chronic sneezing, the nasal discharge, maybe with blood, that's really important for getting it diagnosed and treated promptly.
And the treatment itself.
Treatment is primarily surgical closure. You have to address the cause, often by removing the bad tooth, and then surgically repair the hole. And remember, there are different techniques vets use depending on the specifics of the fistula.
Requires skill and careful planning.
Absolutely.
Okay, great summary. So let's leave our listeners with a final thought to maybe chew on. Considering how closely linked the mouth and the nose are physically, it really makes you wonder, doesn't it? What other health issues in our pets, things that seem totally separate, might actually have surprising underlying connections we just don't always think about.
That's a good point.
It's kind of a reminder that the body is this incredibly complex system, and sometimes the root of a problem isn't where you first expect to find it. Things are often more interconnected than they appear.